Both of these patients are waiting for a liver transplant, and one has just become available. Patient A, on the right, is a 46-year-old woman with a husband and 2 kids. Her diagnosis is liver cirrhosis from alcoholism, and her chances for survival after a transplant are very slim. Patient B, on the left, is a 53-year-old man. He's widowed and has no children. He is diagnosed with congenital liver disease and depression, and he has no desire to live. He resists medication and treatment, and his chances for survival after the transplant are great. The doctors and nurses are having a roundtable discussion on who should receive the transplant.
Okay, team, so everybody talking about patient A and patient B on the liver transplant and who deserves it the most. So what do you guys think?
Well, for me, I think patient B deserves it the most. Just because of his health history, his comorbidity, he has the greatest chance of survival during the surgery and after the surgery.
And what about him, you know, he didn't take his health for granted before. He's not an alcoholic. And because of that, you know, his behavioral lifestyle would be more conducive to him receiving this transplant. He'll be more successful.
I agree.
Don't you think that if we get the appropriate interventions in place for patient A, and that we can get her back on track with her life, and that...
Why now, though? I mean,
To be honest, like, we've seen her so many times before and given her so many chances, and she's yet to change her lifestyle. So who's to say she's going to change it now?
Well, she has a family. Like, she's going to leave 2 kids behind her husband. So, I mean, she can't change.
And the thing is, too, we have seen her many times, but we've recently received a report from a social worker indicating that she's a very dedicated person to her family, at work. She does an excellent job. She has a great history with that. I just think that given the community center that she has been, you know,
involved with.
yeah, that honestly just does not have a good track record, right? I just think that we can get her connected to the appropriate resources that can have her overcome this addiction. And
I agree with you.
Oh,
That makes sense.
so because patient B doesn't have any family, you know, because his wife recently passed away a couple months ago, and he's depressed right now. He doesn't want to live anymore, and he's expressed that he doesn't want the pain medications.
Do you think he'll change his mind if he knows he's going to deliver, or will he still be depressed?
I think if he knew there was a liver available, then he might, you know, completely change his mind. He might view life differently. He's 53 years old. He's not
still
that
young,
old, you know.
Well, she's young too. What about her kids? What are they going to do when she passes away if we didn't help?
Again, going back to the greater chance of survival, like, I strongly believe that patient B should get it just because he probably will survive the surgery, and we're not sure about patient A. Well, clearly we're not coming to a decision right now, so me and you are going to have a talk after.
Yes.